Okay, we'll jump straight to our next presentation, which is going to be delivered by Jessica Moore-Jones. And Jessica is a veterinarian, a business owner, a leader, consultant, and a coach in what she calls the people part of the animal industry. Having managed major animal organisations, including as a senior advisor to Auckland Council Animal Management, executive manager at RSPCA WA, CEO RSPCA Darwin, and manager wildlife health at Taronga Zoo, Dr. Jess now runs Unleash Coaching and Consulting. Here she works with vet clinics, local governments, animal shelters and universities to develop and empower their teams, their leaders and their community outcomes. And Jess is presenting on Stop Preaching to the Converted, designing interventions that target the right people. Welcome, Jess.
Afternoon. I feel like I've got 20 minutes to talk to you after lunch on day 3, which is a bit of a challenge. So I sort of thought, rather than giving you lots of theory and lots of, how human behaviour works and all of that stuff, I was just going to throw some really hard questions at you, and then you get to go away and answer them without anybody helping you. So that's pretty much my plan. But I promise at the end, what I'm also going to do is just list a whole bunch of ideas that might work depending on your organisation, your communities, what you do for a living. And so have your scribble bits of pen, or obviously you can re-listen to the recording as well at the end. But really, I just want to get you to think about whether your approach is the only approach. And then at the end, I'm going to just chuck some ideas at you to see if it gets your brain juices flowing and whether it sort of fits with what you need from your organisation and your community. So who am I? You already heard all that stuff. I really got into the human behaviour element of the animal industry because I couldn't get people to do what I wanted them to do. I was having the same conversation over and over again, whether it was in animal management, whether it was as a clinician, whether it was with my staff, or whether it was in sheltering situations. You just found yourself 5 minutes or 20 minutes at a time having the same conversation, and it just felt like no matter how hard I work or how hard I try, every year I throw more resource and more emotional energy at it, and I get kind of the same results in a different scenario. It's the same thing over and over. So that's what led me to be interested in the human part of the animal industry. So I now work with this part, and also with animal shelters and animal management organisations on their people, resilience, culture, emotional intelligence, that sort of stuff. But today we're going to talk about stopping preaching to the converted. If you know what I mean, you know what I mean, all right? Which is, you put 80% of your energy doing these wonderful programs, and we've heard about a bunch of them over the last couple of days, and these amazing community things, and we have community walks or free desexing or microchipping or drive-through vaccinations, and you get great turnout and it's awesome, but the people who come often aren't the people that you really needed to come. You have a tendency towards putting 80% of your efforts and energies not at the 80% of people who needed you most. And that is something that most of us struggle with. Now, please don't think that those community engagement activities that you're doing, where you're getting a great turnout of middle income earners, of responsible pet owners, are a bad thing. They absolutely have their place, but they have a different place in animal management and in animal sheltering than is the place of really targeting the demographics that most often can have the biggest impact on the safety of our people and the welfare of our animals. Because those people don't tend to come to a nice dog walk in the park on a Sunday afternoon. And so that's what we want to talk about today. Why are we talking about it? Well, because if you're anything like me, you're having the same conversation over and over again, and you're spending 80% of your energy on 10% of your people. So, like I said, I'm not going to give you any answers today. I'm going to ask you a bunch of questions. Firstly, is what you are currently doing working? I hope that a bunch of you, the answer is yeah, mostly. Or at least, yeah, sometimes. But if you have pockets of your communities or demographics of dogs out there or cats or a particular issue that you're facing where you're doing the same thing over and over again, every year you try it slightly different with slightly more money, slightly more energy, and you're not seeing more than incremental changes, then I would challenge you to ask yourself whether there could be different ways of looking at the problem. Second question I have for you is, what outcome are you really looking for? Now, this will be different for your organization to the organization next to you. If you're animal management, it might be about community safety, keeping our children not getting bitten from dogs is the #1 priority we have. If you're in animal rescue and your ultimate aim is just to save animal lives and that is your ultimate priority, then that's equally valid, because if we weren't all in this room doing our own little niches, none of us would succeed. So nobody's ultimate outcome is better than anyone else's. But like Jim said earlier, one of the questions that we have to ask ourselves is, what is our job? And is it to fund our local government? And is it to get more dogs registered? Or is it to know where dangerous dogs are? Because those two things we tend to treat as the same thing, but they're not. Equally, if you're in welfare, more than management, you might think that your ultimate outcome is for all animals to be living at X standard of welfare. Or actually, could your outcome be that dogs are living a good life? And that might not look like what our dog's good life looks like, but is that an okay outcome? I've put up there responsible pet ownership does not count as the outcome you're looking for, because responsible pet ownership means a different thing to every one of us. I consider myself a very responsible dog owner. A few people in here know my dog, and he is spoiled, and he sleeps on my bed, and he is microchipped and vaccinated and insured, and he has moved country with me 4 or 5 times, and he, in my view, is the most looked after dog you've ever met. But, this is where I make enemies in this room, he is regularly off-lead in an on-lead dog area. All the time, almost every single day of his life. He has been and will continue to be until the day he dies. Because, I'm not going to tell you the because. Because the next question is, why aren't people doing what you're asking them to do? And are you sure? I do training with animal management or vet clinics as well, and I sit in front of them and I go, okay, what's your scenario? Why did the person not do it? And every single time, a room full of people give me the same 4 answers. Cost, don't know any better, don't care, or they're a dick. Like, that is the 4 responses that I'm always given for why people did not do what you asked them to do. Whether it was finish the whole course of antibiotics, keep their dog confined, vaccinate, microchip, desex. It's always don't know, don't care, can't afford it, insert expletive of some description here. And the problem is, they're rarely the real answers. They're often the easy answers. They're quick. We get to them quickly. They make sense. It's easy to just chuck them in a box. But they're not acknowledging that people are human beings. And so I always say, if you can come up with the reason by asking me any questions you want afterwards, why my dog is regularly off-leash in an on-leash dog area, you can have 10% off any of my trainings, okay? Because you have to be able to understand people to understand why they're not following your recommendations. So if you haven't been in their position, and given that this talk is specifically focused on the 10% of your population that aren't coming to your trainings or aren't opening your Facebook pages, if you have never been where they are, if you have never not knowing how to feed your kids tonight, if you've never not knowing if you're going to be sleeping in a car, if you've never had to choose between your animal and your home, you really, really shouldn't be making assumptions that those 4 easy, quick to reach answers are why people are not doing what you're asking them to do. So just leading on to that, some very quick key concept takeaways. That particular demographic that I'm talking about, if you've never been in the position where the sight of an animal management officer makes your children hide, you don't know what we're talking about, and you shouldn't be going in there because you haven't made a good plan for that demographic of people. When we go in there in uniform, which I know a lot of us are getting a lot better at, but a lot of our animal management officers are dressed like rangers, which look a little bit like cops. And we're going in to demographics who do not have reason to trust you. In fact, have quite the opposite from a very young age. So reactance is a concept I just wanted to chuck out there. Go and Google it in more formal terms than I'm going to chuck it out there. But our very natural human response to a perceived threat to our freedom of choice. So when you're a toddler, like this isn't abnormal behavior, this isn't one particular demographic behavior, this is from when we're like, I have a 15-month-old, she's doing this. The second you think that someone is going to take away your choices, you cling to your choice. And so if you're going in there as the authority figure, and that doesn't even have to mean dressed like a ranger here, that can mean going in there as the veterinarian who's the knowledge authority figure, going in there as the boss in your organization, going in there as the sort of well-to-do shelter that, oh, you guys preach all of this stuff, but it's not real life. People in my world don't live like that. Then people's perception of their threat to their freedom of choice is almost instantaneous. Now add to that not only is the reactance kind of, nah, I'm out, not listening, I'm not doing this, not only is that stronger when the person has a position of authority, but add to that effect that we were talking about earlier, where some of the people who most need to hear it are the people who are most afraid of authority figures and don't have reasons to trust you. Cool? I know I'm throwing a lot at you really quickly. I talk really quick, I'm so sorry. Other key concepts, imperfect solutions that people follow are better than a perfect solution that nobody does. Please remember this. We spend so long trying to get this perfect scenario happening, and we've got like all of the stuff, and oh, well, if it just looks like this, and if it just looks like this, and we've got to get the wording perfectly correct. Because frankly, let's face it, particularly if you're local government, I'm sorry if I offend anybody, I do that all the time. We're usually moderately educated, middle-aged white men. And so we write our stuff as if we're talking to moderately educated, middle-aged white men. And then we translate it into another language as if they're a middle-aged white man. And we forget about all of the nuances of the fact that if that community is going to do animal welfare and the safety of their children, it doesn't matter if it looks like what it looked like at your group of friends' barbecue. As long as it's happening, it's going to look different in their community, in their house, in their culture. So an imperfect solution, but that they're willing to do, way more effective than your perfect academic solution, but that you can't get people who aren't just like you to follow. Thirdly, principle, Swiss cheese. Lots of different imperfect solutions is how we keep people and animals safe. Lots of different tools. I talk about behavior change. Those that have heard me talk before, there's whether you want to go full down the line of, working on people's values, or we want to go into nudges and all those kind of quick little remedies. All of those things are useful. Every single thing that all of you guys doing in this room are useful tools, and when they go together is when we actually start to have an impact. And lastly, I know a lot of people have touched slightly on this, but equality versus equity versus inclusion. Nice little picture on the side. One of the pushbacks you get when we do some of this work, and again, Jim made the point earlier, is that our job in animal management shouldn't be to make comfortable the wealthier demographics in our areas. One of the pushbacks that we can get when we spend a lot of our energy working with particular demographics is that, well, why are they getting all the money poured into there? And all I would say is just make sure you're across the difference between equity, inclusion, and equality. So that's me just chucking a whole bunch of questions at you. All right. I was asked, can I get some cat containment stuff into this talk? So I'm going to. And we even have some wonderful people, and we've already heard about this great study that was done very recently about why people are or are not choosing to contain their cats. And this is a wonderful example to me because it's a good study. Yep, as was acknowledged, you know, possibly we've got a biased sample of people willing to respond to a study about their cats, but it's okay, nothing's perfect. But what I still see everywhere is they've come up with these different profiles of the people who responded. Why are they not responding, or why are they responding? And some of them are motivated, capable, and have the opportunity. And then the ones down here have neither the motivation, the capability, or the opportunity. All right, they don't know, they don't care, and they're not going to. But all of our efforts are still up here. We are still working on, oh, well, people psychologically don't know how to do it, so let's give them training videos. Or people don't feel like they can do it successfully, so let's give them tools to do that. Or people don't know, how, so let's work on that. But you're still assuming that they are these people in these categories. And as you'll see from the numbers, more than half of our people are actually down here. Don't know, don't care, don't have the opportunity. So, some very, very, very quick tools. I said, going to have to listen quickly because we've got 5 minutes left. Cats, cat containment. I want you to start thinking about those other people at the lower end of that table. What are we going to do to give them an incentive, a motivation, or an opportunity? What does matter to those people? Rather than going, well, I know what matters to me about my cat safety, how do we give them something that does, okay? So if you want them to do cat containments, what matters? Because if you see in this slide here, these people are the least female, high urban, and the youngest of the cohort. What can't those people get right now, top of my head? Housing, rentals. So what do we target? We want to target public housing. What's the default fencing in public housing? We want to target, you guys work in local government. You have control over the building consents. What do they look like? What are you doing when you consent to what the fences in a new subdivision look like? What are you doing with your registration for cats? Can they opt out of paying their registration fee if they install the slidey things they can't climb the fence over, which I can't remember the name of right now? All of those sorts of things are instant, immediate things that you can control, or at least somebody that you should be partnering with can control. That means that we don't have to have people with the motivation, opportunity, and incentive. We just create one. Wider than cat containment, all of those things are still true. We start thinking about defaults, okay? You've got control over building consents. You've got control over public housing. Why don't they all have self-closing latches so that dogs can't get out? Why don't they all have areas so that dogs can't see people walking past on the front? And I'm not saying they all have to. I'm just saying you build into the system. It's easier to build that way. Maybe it's cheaper. Maybe there's a reverse nudge, which means if you're not going to add cat containment fences to your new subdivision, you have to fill out an extra 5 pages of paperwork about why. Why don't we just start making things easier and more normal for them to do what it is that they want to? Again, starting to think about what's important to the people that we want to come to our thing. If you're putting on drive-through vaccinations, a free desexing clinic, microchipping, what's going to get the people there that you actually need there, not the people that were probably going to do it anyway? Do you have to give out free school uniforms at your microchipping event? Is it about free dog food at early bird registration? Is it about kids get a hot breakfast if they come to your microchip drive-through? What matters to the demographic that you're trying to hit? We also really want to think about diversions. Okay, diversions from infringements, rather than just thinking about, you did the wrong thing, here's an infringement. You can't get these people in a room to go to training on how to keep their dogs safe. Well, now you've got an opportunity, don't you? Pay the infringement or sit in the classroom for half an hour. all right? Because you can't get them to come voluntarily. It's great to think that we could think about it, but they don't. So we've got to find incentives that work for the people that matter to us. Diversions for your registration fees are also equally important, and in fact, probably more so. When you think about registration fees, what could they do instead of paying you money? Because remember, if the outcome you're looking for is knowing where the dangerous dogs are, not getting dogs registered, can they have to fill out a quiz in order to get their dog registered? Can they dob in a mate and then get free registration? If they register 5 other dogs in their street, do they get their registration for free? Start thinking about how do you create human behaviour change by giving them what they need, not what you need. And that's me out of time like normal. And of course, I'm going to say right down the bottom, I highly recommend you rethink dog exercise areas, and then you might get my dog on a lead every now and then. Oh, lastly, what gets measured gets done. This is a little thing that I'm trying to work on, getting more uptake on, trying to think about how we actually do proactive work in our organizations rather than it just being an afterthought. How do we actually make it a measurement that we are all committed to achieving? And that's me. Sorry.